And she's got what most of us gals have over the age of 40 that haven't been treated, a lot of minor skin irregularities. And so we're going to treat her today with the Skin Classic, but prior to that we're going to dermaplane, and we're going to do two different types of dermaplaning, one on each side of her face. I've gone ahead and cleansed Coral's skin with RN Face's Redwine Cleanser. It's an antioxidant cleanser. It's all organic, wildcrafted, and very gentle on the skin. Right now what I'm going to do is use a little of the Redwine Cleanser, the Redwine Toner antioxidant, and it's full of glycolic, alpha hydroxy, witch hazel, hyaluronic acid, and what it's helping to do is helping to strip the skin. And if you notice that I use a 4x4 rather than a cotton pad, is to get a little bit more of the skin to lift. The desmosomes will dissolve and then they will come off onto the pad. If I use a smooth pad, I'm more or less just putting the product on the skin. I'm really trying to work it in and help even get more of the sebum off of the skin. Okay, so what I've done is taken some mask product from RN Faces. It's a Redwine Mask. It's a very gentle mask. I'm going to place that on one side of her face and then dermaplane this side dry and then this side with the mask. So you could do either way, but I just want to show you two different ways. I do like to put it in a little Dixie cup when I'm working so that I don't have to dip into the container. This is going to be a little cool. And we're going to let this sit on this side of her face for about 10 minutes, and that will be about the time it will take to dermaplane the other side. So she may feel a little tingle, but this is a gentle mask, and what it's doing is helping the circulation. So anytime we do any kind of medical procedure on the skin, we definitely like for the skin to be invigorated so that it will help with the healing quickly. So just like that, just a thin coat. And we're just going to let that sit like that. Okay, so I've loaded my 10 blade for the dermaplaning, and you can use a 10 blade or you can use a 14. My choice is a 10. And this won't hurt at all. This feels really good to the client. Again, be very careful when working with dermaplaning equipment. You will see the ridges on the knife handle. That's for you to hold, and we're only using the very bottom of the blade. We never toe it in. All we're doing is basically giving the client a surgical shave, which takes off the stratum corneum as well as some of the vellus hair. So I'm just going to give you a little touch here, Coral, and make sure everything is good. Does that seem to be okay for you?
Just fine.
Okay. So what I'm going to do is try to keep my hands out of the way. I'm going to turn your head just a little bit there. And you'll start to see some of the cells coming off of Coral's skin. And I want to be gentle, but you'll see this white vellus hair kind of being removed. I'm going to turn even a little bit more. Around the eye, I like to stretch it a little bit more so I can get in there and really get those cells down. You know, men have that great advantage of shaving every day, and that's why a lot of men don't have as many fine lines and wrinkles as us gals. Not that we want to do this every day, but does that feel okay to you?
Yes.
Okay. I saw you twitch a little and I wasn't sure, but you can see how the vellus hair is just coming up nicely. And as I'm doing this, I'm also inspecting her skin closely. I can see the minor skin irregularities that I will gently point out when I'm done with the dermaplaning. Just want to turn it a little bit. It doesn't feel so bad. Probably feels pretty good.
Mm-hmm.
So you can dermaplane any part of the body. What we like to shy away from is the jaw itself, the chin, and that's because it's very vascular, and if you were to nick the skin, it would bleed a little bit. I even try to get up here a little closer to the eyes. So this is sort of a pre-treatment. goes right there. And just a little on the chin here. I don't want to do too much because I don't want to aggravate that skin. I like to do the upper lip, and I just gently, very carefully come in. I'm going to turn you just a bit. Okay. Turn you back just a bit. Okay, now I'm not going to do the nose. Okay, so that side is done. Now I'm going to go ahead and turn you this way just a bit. And because she does have the mask on it, stretching is just a little bit more difficult. So I want to hold there, get there, and just take this off. Turn you this way a little bit. You want to make sure that you don't get her eyebrow. When you have a mask on, sometimes you may not see exactly where you are, so you want to make sure, be very, very careful. Turn it a bit more. I'm going to turn your head this way for me. I'm going to come down here so I can get my good stretch on drier skin. Some people prefer to work on moist skin. It's just up to you. You can work either way. But I just wanted to show you two different ways and how to make more of a procedure of just a dermaplaning procedure. You'll have just as much vellus hair removed either way. So get in here. When you're doing it with something, a mask on the face, you tend to not miss any spots either because you can see exactly where you were. And the mask has a very gentle smell. All of these products that we use from RN Faces, they are organic, wildcrafted. They're not made with extreme scents to them. I don't like anything too smelly on the skin. Okay, so we're done that. I'm going to take off my glove and just give the skin a little wipe off. Any residue, and I'll go ahead and just degrease with the toner again on this side of the face. And you can do this with a papaya enzyme type of a treatment as well. So now I'm ready to go ahead and inspect her skin and let her know what minor skin irregularities that we can treat and that we can't treat. So I'll take my Q-tip and I'm going to start with her forehead. And you can always offer your client a mirror, although I've gone over all this with Coral so she knows what I'm talking about. But when I look at her skin, I want to look and I want to feel. And in the very corner of her hair right here, she's got a little, what we would call a little fibroma. I'm going to turn you a little more. Okay. She's got a couple cherry angiomas in the hairline here, which are always nice to start with our treatment because she can see what it feels like and there's not as many nerve endings and it's not quite such a surprise. So when I stretch her skin and I feel it, again, I feel some of these little fibromas. And I don't know if you can see those with that camera, but they're little bumps, and I'm sure you feel them when you put on your moisturizer and things like that, right, Coral?
Oh, yes.
Yeah. Mm-hmm. And so let's see here. Not too much there. She's got a little clogged pore right there. Her forehead seems to be really nice and clear, and most people's are because that's where we get the least amount of sun damage. But if I look real close over her eyebrow here, she's got a few little... Okay, so that's lifted, and it will slough off in the next 3 or 4 days, be a little pink underneath, and then start to blend into the skin beautifully. Let's see what she's got. A little bit going on here. I don't have any current on. I just want to try to slip this into this pore without the current. There we go. And it just opens it up. There we are. And just took it right out. So many times, especially if you're dealing with your young acne clients, try using your Skin Classic without any current, just going into the pore, stretching it, and the material should come right out. Again, she's got another little fibroma here that I just spotted. And when I say it like that, that's why a lot of times people say, well, can I use anesthetic? Well, you know, I noticed all these other things, but when you come across something else and then you don't have any anesthetic on them, it's going to feel different. And the anesthetic, believe me, just takes the edge off. She's got a few little things here in the eye area. That now she's used to the sensation. So if I'm closer to these areas that tend to ouch just a little bit more. And I felt her clench her jaw, so I knew what I was doing was hurting just a little bit more. So I kind of gave her a little rest. So we're done around this part of the face. We'll go ahead and do this capillary here. And I would normally change my probe, but her capillaries are fairly large, so I want to use a size appropriate probe, which for this is the F12. And first I want to look and see if there's any little capillary that really needs to be treated on, not very many, but these right here. I'm going to give you a touch coral and see how this is for you. That's a little ouchy, huh?
Yeah.
Well, it surprised her too. Right. Right. Okay. So you just want to stretch. You want to come along the line with a 3-second touch, because you need enough time for the high frequency to have that capillary come out of its compartment and be absorbed by the rest of the tissue. So give her a little rest, because this is the one thing that does bother your clients the most, that bothers me the most, makes my eyes water. But you can see how it's just going away. So your treatment regimen for this is going to be very gentle cleansing from now till the skin is smooth again. Make sure you don't use your terry cloth to rub your nose clean. Now, okay, and I'm going to get that last little bit. Sometimes if you let the nose relax, if the capillary's under the nose, there's no sense in going any further, because you won't see it when they sit up. So, okay, so you've seen that. Okay, so we're done with that. We're going to go on to your neck here and take care of, you've got a couple little skin tags. Let's see here. And a couple cherry angiomas. So I'm going to bring it to our cherry angioma intensity. And I'm going to give it a little touch. Let's see. No fluid, just a touch. I have to really hold it until I really see it start to change. And you have to be patient. If you are a Skin Classic owner, you know what I mean. When you touch, they don't automatically just disappear. You have to have enough high frequency time on them. Here's a little skin tag. And for those barely touching, I did put a little witch hazel on it. And you want to touch the whole thing. And without touching the good skin underneath. Not that anything would happen, it's just a little bit more uncomfortable. There's another tiny little skin tag. See how they turn a little grayish? Not all of them look the same when they treat. So this one looked a little different than this one, but I'm not going to go back to this one because this one looked like it was treated better. Once you've treated it, you go and move on to the next. You never ever want to retreat. So there's a cherry angioma. Gone. Okay, so we'll work her décolleté here in a very methodical fashion. And what we're trying to do is accomplish making her décolleté look more homogeneous. Some of these, we'll treat these flat hyperpigmented areas and this cluster of capillaries. So, and that's a little rough brown spot. Raised here, little raised fibroma. A little bit more witch hazel. How you doing, Coral?
Doing well, doing well.
Good. Okay. So our flat hyperpigment, you want to be very careful with because it's flat on the skin, and you want to be methodical. As large as this one looks, you don't want to treat haphazardly. You want to treat very methodically, and I'm going to treat in lines. Tap, 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 tap. Give her a little rest. Tap, tap, and that one's treated. And here's another tap, 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 tap. Right next to it is a cherry angioma. Okay, so I'm kind of treating in this mode here. I'll treat these. She likes to wear her low-cut shirts. So you can see that some of the pigment even comes up off onto the probe here. Okay, we'll do these last with a different probe, a smaller probe. Here's a larger cherry angioma, and I'm going to hold it. I might need to hold a little longer than normal. Nope. Here's the one everybody's been wanting to have treated. So I'm going to pick it up and move it to the next area that is red. I was a little short on that one. There we go. So you just have to be patient. Okay, so that all looks pretty good. I think, unless you think I missed anything. Oh, a little skin tag here. If can the camera see that? Can you see that? Okay. So I'm going to put it on this, and it's that little floppy one that you felt there, Coral. Yeah, sometimes it might get stuck on your necklace. Okay, so I'm just going to pull the skin like so, and I'm just going to tap the entire head. And what's going to happen is it'll turn white like a little cupcake, and this will fall off in a few days. If you have a very large skin tag, it may need a couple treatments. There we are. Good deal. Okay, well that concludes this side and her décolleté. I'm going to go ahead and do the other side. We'll take a picture, I'll moisturize and with a moisturizing sunblock, and then we'll let Coral go. She'll be back in the office in a week or two for some more pictures, and then in a month to get her full healing, what she looks like. Well, thanks, Coral.
Thank you.
Alrighty, I neglected to treat the capillaries on film, so I want to show you how to track this capillary. I go to the smallest end here, and I'm going to touch 3 seconds. 1, 2, 3. 1, 2, 3. 1, 2, 3. So you can see it's a pretty tedious procedure. However, it's so effective. Keep your probe close to each other, and you'll see that the capillary just disappears. And you want to make sure that your client is ultra careful with terry cloth, not to scrub the area, not to break anything open. And as you do this, sometimes you'll see that the redness sort of disappears. So I'm just going to do this last leg here. That's a little different than the nose, wasn't it, Coral?
This was much easier than the nose.
Yeah. The nose can be a little tight, so make sure that that's one of the last things you do for your client, because they may think it's a little bit more uncomfortable. But the great thing about this machine, there's no noise, no buzzing, no spark gap at the end, so it's not a bifurcating type of machine. It's silent, and it does create a little discomfort, but you can see that we can get through a face, neck, and décolleté fairly quickly with client as comfortable as possible. Okay. And I just want to show you, I do have my F6 probe in, my tiny, tiny probe. But if I see something else that I wanted to clean up, I don't have to change back to my F12. Watch, I'll treat this cherry angioma with that. You treat that one that I hadn't treated. Okay, well thanks everybody.